Thanks for being here today. Yesterday I signed the paperwork to allow St. Louis County to receive the federal stimulus funds from the CARE Act, the Economic Relief Stimulus Package from the federal government. It has many, many components in this $2 billion package. Part of that is $175 million that comes directly to St. Louis County for us to address the three crises that are in front of us: the public health crisis, the humanitarian crisis, and the economic crisis. We will be focused on saving lives, providing residents with their basic needs, and reviving the economy. While this is a large sum of money, it can only be used for COVID-19 related events. They must be approved by the federal government. It must pass the test of the Inspector General. And in the next week, we will see rules and regulations from the federal government on exactly what it means to be COVID-19 related. Any money that we do not use by December 31st must be returned to the federal government. Earlier this week, I asked the County Council to create a special fund to receive this CARES Act money. I also asked that we create a web portal so that we will have a transparent way to watch in real time as these expenditures are made. We already have expenses dating back to March 1st that are eligible for reimbursement from this federal stimulus money, and that's important because, like all local governments, like our state government, who depend in part on sales tax, we will have less revenue this year than we expected, and our budget will be short. The money that we have spent on this emergency response that was not budgeted can be reimbursed from this federal stimulus money, and we will start the process of doing that and try to return those funds to our Treasury. This will be transparent. This web portal and accountability process is good government, and this is the right thing to do. To create this fund, there's legislation before the County Council to do so. We will hope for swift approval at their meeting on Tuesday. And if that happens, we will begin very promptly buying tests, and more tests. Tests that will help sick people, help them get the care that they need, but also help us set up the infrastructure, a robust testing environment and case management environment, contact tracing environment that will allow us to reopen our economy here locally. When I asked to establish this fund, I recognized the impact of the COVID-19 virus on our underserved communities. We've seen this virus hit extraordinarily hard in our African American communities, not just here locally, but across the country. We need to stop the inequities in the provision of health care in our underserved communities. This COVID-19 virus shines a spotlight on those inequities. If we don't have full council support on Tuesday, then that will delay us a week in purchasing the testing supplies that we would like to get started purchasing. It is an extraordinarily competitive environment to purchase testing supplies in a national shortage. We have been able to purchase small bits and pieces, small orders like everyone else, but it's time that we step up our participation in the testing as they become marginally more available across our country as production has increased some. In addition, we will spend this money on PPE for our first responders. We are now providing PPE to vulnerable populations in skilled living facilities, senior living facilities, nursing centers, nursing homes. We also need to be able to rent hotel rooms for quarantines for people who can't quarantine safely at home, which is uncommon, or homeless, or our first responders. We don't want our first responders to have to quarantine at home with their families because we know that 70 to 80% of the transmission of the COVID-19 virus happens in a household. I'm also thrilled to recognize that Cindy Brinkley will be joining our team. She has volunteered in my administration to act as a senior advisor. I know that she will help us do whatever is necessary to make sure that the county accepts these funds and spends them in a responsible way that is transparent and that is consistent with the federal regulations, so we are not put in the position of having to return any money that was not spent appropriately, but we were also able to get those funds in the hands of people who need them as quickly as possible. She will lead a group of different backgrounds, different perspectives, and we'll look at this spending through an equity lens to make sure that we respond to this crisis in a swift and responsible way and get the maximum benefits to our citizens. I don't expect perfection, but I demand integrity, transparency, and compassion. Cindy has built her career on these three pillars. Her resume in the private sector is uniquely qualified and qualifies her for this challenge. She has built a career on transformational leadership. Most recently, as a part of Centene's executive team, she was charged in integrating many of Centene's acquisitions into a high-performing healthcare leader. As Chief Human Resources Officer at General Motors, Cindy was charged with restoring faith and morale in an auto giant as it emerged from bankruptcy. And at AT&T, she was Senior Vice President for Talent Development. Cindy was responsible for developing all the training at that corporate giant. Thank you, Cindy, for agreeing to lend your talents. As we work around the clock in response to this virus, I've had countless meetings virtually with businesses, clergy, and elected officials to help navigate the path forward. Before and during this crisis, I've met with 88 mayors of municipalities in our county. They tell me that I've met with them more in the past year than the previous county executive met with them in the past 5 years. In fact, many of them told me that they had never been to the county executive's office before. We have worked hard to ensure that none of them can say that now moving forward. It's certainly frustrating for me in an emergency setting to not be able to communicate as frequently with all of the leaders in our community, elected officials, nonprofit leaders, and others. We are doing the best that we can in this emergency with limited ability to meet, and those meetings are held virtually. There is a misunderstanding that these funds, the stimulus funds that have come to St. Louis County, can be used to replace lost revenue to local governments because of declining sales tax revenue from the economic fallout of COVID-19. That's not what the federal legislation says. We do understand that there is a discussion currently in Washington to provide relief to local governments like St. Louis County, like our municipalities, to help that revenue shortfall for those of us who depend a great deal on sales tax revenue. But the stimulus package that's in front of us now cannot be used on anything that is not COVID-19 related, and it specifically says in the legislative language that it cannot be used to replace lost revenue from sales tax. We know that small businesses are the backbone of our community, and we know that this has hit them very hard. And our focus in St. Louis County will also be on the economic recovery and how we can help these businesses recover. I did read some reports in the news that these communication breakdowns were driven by a partisan election cycle, which is just around the corner. I'm really not ready to make that suggestion. We all know that partisanship did contribute to the initial lackluster response at the national level, but we are now moving forward. And in fact, there was a fantastic bipartisan effort by our members of Congress to get this stimulus package to St. Louis County so we can put it to work and start helping our citizens. The stay-at-home orders that were extended yesterday by Mayor Krewson, by Governor Parson, and myself are necessary to slow this virus. I know that these stay-at-home orders are incredibly inconvenient and they are devastating to our local economy. We understand that, and we are preparing a path forward. Shortly after COVID-19 struck our community, we set up a website in St. Louis County as a resource for information, for instructions, for our executive orders, for our public health orders, and for frequently asked questions. There's also information on how to help, how to make donations to our Emergency Operations Center, and other questions that you might have. The website is stlcorona.com. This has been an invaluable tool for St. Louis County residents. Today, the site is officially relaunched. It can now be translated into more than 79 languages. It has a search function that is mobile friendly. This was rebuilt with input from our community, and I want to thank everyone who helped us with that effort. We have many groups, nonprofit groups and others, who are working with us in a cooperative manner to help us get the resources that are needed to our residents. Before I open up to questions, I would like to recognize Cindy and see if she would like to make a few words. Cindy?
Thank you, Dr. Page, and good morning, everybody. You know, it's a privilege for me to be a part of this effort, and I think all of us look time to time about how we can give back, and this was my opportunity to lend expertise to help set up the right structure, the right function, get the right people engaged, to make sure that we can effectively and spend the funds that we'll be receiving from Washington and to use those funds with the greatest impact. And an important part of that, of course, is the transparency that we'll have around this, and importantly, the compliance aspect of it. Obviously, we're going to have to make sure that we spend these funds in the right way, and they'll be, checked in Washington on this. So it's a privilege for me to be a part of this, and I know I'll be tapping into a lot of expertise around the county, getting input from many. So I appreciate the opportunity. Thank you.
Thanks. Okay, I'd be glad to answer any questions.
Can you ballpark at this point, strictly ballparking, the expense that the county has incurred since the onset of this?
I hope to have those figures by next week. I know initially we bought $7 million worth of PPE. Some of that is reimbursed because we provide that for fire districts. I expect us to buy millions more. We're working frantically and competitively to buy testing supplies. Our contracts with hotels for quarantines will be extraordinarily expensive, but I can't give you a ballpark number. Once we get that transparency portal up, I hope within a week, we will first show the expenses to date, and then we will continually update that as we enter into agreements to try and take care of people in our community.
So the portal, once it's launched, is that hopefully next week that it will show in real time, you said?
Yes.
Expenditures and then what is able to be reimbursed?
Yes.
Really, would that start Tuesday if it's approved by the council?
What's that?
Would that start Tuesday?
The portal? Oh, it's under construction. One thing certainly I don't want to do is give you a time and date in case we miss that, but we're working furiously on it. The funds won't arrive until April 24th. We'll certainly have it ready to go by then.
Can you speak to, and I know you've been asked this a million times, and I know you're not alone in extending the stay-at-home order, but we've heard from some businesses in the county who they get kind of apprehensive when they hear that word indefinitely.
Mm-hmm.
And they're asking us, is there a sign, is there a criteria, is there something that they're looking for that we can hold on to as a sign of hope that they might ease some of this? Can you speak to that at all?
Yes, and first of all, I think we have to recognize the devastating impact on our economy, and none of us take that lightly. This is a historic effort. It is something that we haven't faced in 100 years. This is a virus that behaves very, very malignantly, and we're still learning about its features and still trying to understand how it bounces back and causes harm if it's not appropriately restrained. The only encouragement I would offer at this time is that we are lucky here in St. Louis County because we implemented social distancing guidelines, and we've been able to avoid the devastation that we've seen across the world and across our country. And that has provided us with a tremendous benefit. And the economic pain of these social distancing orders now really will bring us great dividends on the other side. And if that other side is sometime towards the end of May or the middle of May, I think that's great. We'll be much better off if we can get the pain over now and not bounce back into it later in a way that stresses our hospitals when they're short on protective equipment, because the national supplies are low, and the manufacturing of that protective equipment currently is barely keeping up with the consumption. We need the manufacturing of the protective equipment and the manufacturing of the consumption to exceed, manufacturing of the testing to exceed what's being used today. And when we get into that environment and we have rapid response testing, both types of tests, a test for immunity, a blood test for immunity, and the nasal swabs for the test of the presence of the virus, then we'll be in the place where we can start to open things up safely and not bounce back with a devastating and unpredictable impact.
We heard Governor Parson say that he wanted to start his reopening plan May 4th.
Mhm.
How will that line up with the county's plan?
I think we need to get a little closer to May 4th to see that. We've seen all kinds of material distributed really in the past 24 hours about what reopening might look like. The states on the East Coast, the states on the West Coast, some states in the Midwest are putting together regional plans, and I think we need to understand that. We need to watch the trends and the curves here in St. Louis County, in the St. Louis region, and we need to watch the hospital system capacity and our ability to purchase testing equipment and protective equipment before we can make a decision on when we could reopen.
Going back, you had mentioned, one of the first things you want to do with the money is buy more tests. They're hard to come by.
Mhm.
But are they out there?
They are becoming more available, marginally more available, as the production increases. It is an extraordinarily competitive environment, and we definitely need to get in line. We need to get our orders in.
And the investment in testing that you talked about on Monday, is that contingent upon Tuesday's vote on this federal fund that would be for that money, or is that?
We have some funds in the health department. We've been able to make some small orders in tests, and we will continue to make those small orders. I would like to make some larger orders, and those would be orders that, if they are larger, there would be a process for that, and I'd like to get that process started. Any other questions?
So
Oh.
we have one coming in.
Okay. Oh, forgot about Facebook.
I know.
Yes.
We're getting 3 dots, so hold on.
Please check out our new website. It does have some new features, a little bit easier to navigate, and the language feature actually is pretty neat. We did work with a lot of partners to get this established.
You can learn
It's a
some
question.
different languages that way.
You can practice some different languages if you like.
So Sam, we have a question from Rebecca at the St. Louis American.
Okay.
What percentage of the testing supplies will be focused on going to the African American community, which has been hardest hit?
We will continue to distribute the tests based on criteria, and what we know is that members of our African American community are more likely to meet the criteria because they have a higher prevalence of chronic health problems and limited access to care. And that's why we've seen on the zip code map so far a very hard hit region in North St. Louis County from having positive tests. And we know from our reports in our hospitals that we're seeing a lot of African American patients hospitalized. We will continue to distribute this, our testing equitably. That is a priority of my administration. Every complex policy question that has come before me in the past year has been viewed through a lens of equity, and we will continue to do that, certainly in this crisis. But it's not just testing supplies that need to be focused in the areas of highest need, but it's also care. And that's something that we're working on very closely in the Public Health Department, but I think that is even more critical to make sure that the care, the resources, the outpatient centers to evaluate patients with symptoms of COVID-19 are in the areas where they're needed the most. We'll be working very closely with our health systems, with our regional partners, with the FQHCs to make sure those resources are there. The question about percentages, we'll match needs with resources, but we do recognize that the African American community has been hit really hard, and we're going to focus on that as a county.
I have one last question. next Tuesday, what happens if you can't reach a common consensus about this fund for federal dollars? What happens then next? You said
Well,
that-
it's a delay. It delays us a week, and we wait another week, and we have another vote. To approve this funding, to approve the acceptance of this emergency fund, like every other body in our country has done, approve the acceptance of the emergency fund, to put it into place, to draw down from it with a transparency portal, with a compliance plan, with oversight by the U.S. Inspector General, and the threat of having to recover that money if we spend it the wrong way. We're doing it like everyone else does. If it takes us an extra week to do that, it's unfortunate, but we will move forward. And we will buy as much, we will get as much orders in for testing supplies as we can with available funds that we can find, and we'll move forward. Any other questions? Okay, thank you.